I can just share anecdotally the half a dozen patients that I have and the reports from the colleagues that I've been working with that we too are seeing improvements that are pretty similar to the other studies. And that is, if you treat them early, they tend to get better faster.
Any complications using the drugs that you're aware of?
I have not seen any at this point in our studies or in the other studies that are out there. Most of them are really, we look at making sure their heart rates are doing fine and making sure that they don't have any vision issues. And so we see improvement with just hydroxychloroquine, but it also seems to be synergized when you use azithromycin. What we're seeing is that fevers go down a little bit faster, cough is definitely reduced faster, and most importantly, people are not proceeding on to ventilator care as often.
So right, we're weeks away, at least, from a larger double-blind clinical study that might give us that information. So are you comfortable recommending this to other doctors? Because there are some out there who say they want to wait before they start using it in practice. How do you advise them as a colleague?
Sure. You know, as a colleague, about 1 out of 5 prescriptions that we write are for off-label uses. We're watching real science in real time. And, you know, we may see a couple of studies that go a different way. You need to aggregate them. People need to reproduce them. And for my colleagues out there, you need to think about what's best for my patient. What data do I have? And the data that we have so far is positive on this. The FDA has now approved its use in hospitalized patients. We're also seeing hospitals such as Mass General and the University of Washington, the University of Kansas, and community practices using this medication. Work there.
Are you on the drug yourself, or would you take it for prophylaxis if we had enough?
Yes, I would definitely use the drug to treat my family and in the right setting for prophylaxis for myself.
So for everybody at home, the theory behind why hydroxychloroquine may work is twofold. In lab studies, it was found that it can stop the virus from invading cells, but the hydroxychloroquine has also been found to dial back on an overactive immune system. That's why people with autoimmune disorders are prescribed these medications. Much of the pneumonia associated with this virus seems to have an immune basis, as opposed to being from a bacteria growing in there that we might get with the flu. So Dr. Collier, are you observing these types of pneumonias in your patients as well?
Well, my personal patients have all ended up as outpatients. What my colleagues then in the hospital at this point are seeing similar results overall.
And as a reminder for everybody at home, please, this is not a time for self-medicating. Do not turn yourself into a chemistry lab. Any plan ought to be reviewed with the doctor. This is a prescription medication for a reason. Thank you, Dr. Collier. I hope to speak to you again.
Good to see you. Thanks.
We'll be right back.